So let's get started. I guess let's start with COVID-19. Over 200,000 COVID-related deaths in the United States, leading the world both in cases and deaths. We'll start that. We'll give it over to Avi. Avi, how do you think Trump has dealt with COVID-19?
I think that I want to start before I talk about what I think Trump has done wrong. I want to talk about what a good response to COVID-19 looks like in order to give us a metric for the response that we've seen, for judging the response that we've seen. So I think that a good response to the COVID pandemic would have consisted of two fundamental characteristics, neither of which, unfortunately, I feel we've seen with Trump. The first is communicating a clear, consistent message which recognized the scope of the problem from the beginning, or as close to the beginning as possible until now. I have not seen that, and I can get into extensive details on how I've not seen that. And the second would have been to do everything in his power to implement an effective policy to quell the number of deaths, which has certainly not happened. I don't think that when you talk about the number of deaths and the number of cases, I think that tells us something, but I don't think it tells us nearly as much as the death per million, in which America is now ninth in the world in terms of severity. There are, what I really want to do in this discussion, rather than simply say things are bad in America, I think that we can tie the degree of severity in America to specific things that Trump has done, which have led to this magnitude of death. So in short, my argument, or well, there's no better word for it. My argument in this debate is two things. Number one, that on a communication level, on a level of leading the country, Trump has failed dramatically, and I'll get into exactly why and how. I mean, there are now recordings of him admitting that he knows the severity of the crisis, and then spending 2 months downplaying it and even deceiving the public about it for, I would argue, no reason, and I'll get into that once I've let Garrett have his say, because I'm really interested to hear what he has to say. And the second thing was the fact that a lockdown wasn't implemented on a national level, which I think absolutely needed to happen, and I'll explain why that needed to happen and how it could have happened. I'm also cognizant, I want to limit my arguments here and be reasonable, because I'm not somebody who will point a finger at Trump and say he did every single thing wrong. Trump was underinformed about the virus by China, which actively concealed it. He was given inconsistent information by the WHO, and I'll get into the effects of that. And Trump also dealt with a challenge that he couldn't have unilaterally implemented a lockdown on the country, because the president of the United States, by most credible accounts, does not have the constitutional authority to do that. So I'm not blaming Trump for a failure to do things that he didn't have control of. What I do want to say is that the WHO gave the same information to the entire world, and China gave the same information to the entire world. So these two things cannot independently or sufficiently account for why we are where we are. The second thing I want to say is that I didn't see Trump as a leader of the country make an appeal to state and local governments to do the shutdown, or to the American people in February or March to support a shutdown, which, by the way, the majority of Americans at the time supported and have supported for long periods throughout the lockdown. And there have been long periods in which Trump did everything, in my opinion, from saying the lockdown would go down by itself. He said that there were only 15 cases, it would disappear, to advancing use of drugs that were either not helpful or even harmful as a treatment for COVID, to saying, oh, we don't want the cure to be worse than the disease. I'm at a loss to understand how we could have a cure that's worse than 200,000 people and counting dying, not to mention the national economy decimated. So in sum, I wanted to say that Trump has failed in both of the parameters I set out. The first parameter being communication, the second parameter being policy. And my ultimate argument throughout this first part of our debate is that just like a CEO which leads a company to ruin in a preventable scenario, or just like an NFL coach that goes 2-14, or just like a general which loses a decisive battle in a war, Trump needs to be replaced for the good of the people to whom he's accountable. That's my take here.
Thank you, Avi. Garrett, the floor is yours.
Yeah, so I'm going to be coming at it from the perspective, kind of what Avi touched upon about things that I think get maybe mischaracterized, admitting obviously some of the charges he levied against a Trump administration, and also looking at the differences, because again, this debate is about Trump versus Biden, not what I think should have happened or what Avi thinks should happen, but if Biden had been responsible, right, of something like of this magnitude, COVID-19, what would that look like? So we could just kind of open it up for general discussion. Avi, what's something that you really want to, I guess, bring up that you think is a point of contention against the Trump administration that we can kind of just hammer out?
Think at this point,
you brought up a lot, so I just want to like kind of go through.
Yeah, I know I went on a lot. I think at this point, let's start with on, I believe it was February 7th, he gets up in this interview and says, I know COVID is worse than the flu, worse than, quote, strenuous strains of the flu. I'm not sure if that's an exact quote. He said it's worse than the flu. We knew it was more deadly than the flu and more contagious. And then he spent literally days after that, gets up in front of the American people and says, it's the flu. You know how many people die of the flu every year? Not only that, he gets up and says he wants the country open by Easter, when his health experts are predicting between 100 and 200,000 deaths. We've now had more than that. Now, I mean, he got up in front of the American people for the better part of 2 months before admitting that this thing was serious and misled them about the severity and the implications of the virus, told us that it would go away by a miracle, told us that the numbers would go down to zero. If, from the point of view, you're not part of the Trump administration, but if from the point of view of a Trump supporter, you can explain to me how that wasn't extremely harmful at a time when COVID was spreading its invisible fingers through the United States, I would be extremely appreciative and enlightened to hear how that did anything other than compromise America's ability to handle this virus, to be honest.
Yeah, sure. So I guess I can't obviously argue against some of the missteps that he made in terms of public communication.
Garrett, do you agree with Avi that he failed at how he communicated the severity of the virus?
Absolutely, because there's the reality of, look, I have so much data, and I'm sure Avi did it as well. That's why he touched on it at the beginning. When it came to making decisions and actions, yeah, he's doing a lot. But when it comes to how he's communicating it to the public, you can kind of tell it's where, and that's the one fatal flaw that he always has, is that he kind of gets his ego in the way of just being able to kind of just be like, all right, well, like, here's what we're going to do. I think the problem with him is that he's always, and he's admitted in interviews, he's always trying to think positive. He's always trying to, like, things are just going to work out. Always trying to, like, think positive. And, like, while I admire that, there's when
you're on that, sorry.
No, it's okay.
Yeah, let Garrett finish, and then I'll be all you.
So sorry. Yeah.
I was just kind of saying that, again, since we're talking Trump versus Biden, right? Or how, again, it's like, I'm going to look at this through a realism lens, and I could easily turn the tables and go, okay, but if the Biden administration was in control, or if Democrats were in control, like, it's not like they did this great job at being able to communicate about it. Or here, back in February, Dr. Ezekiel Emanuel, this is late February, by the way. This guy was he was the most prominent member of Vice President Joe Biden's Public Health Advisory Committee. And he said, quote, most people are thinking that there may be a bit of an overreaction by many, maybe even our own country. That was him being interviewed by Penn Today as he came back from his meeting with the World Health Organization. And there's so many times, and we can get into it, there's so many times where Joe Biden and Adam Schiff, Democrats in the House, are saying, oh, the travel ban, it's so xenophobic, it's so crazy. And it's like, so again, from the realism perspective, we're talking about Trump is in office, Biden. So what did people say? Again, Andrew Cuomo, governor of New York. New York, by the way, top 5 state in the entire country that was affected by COVID had so many deaths. Here he is in March. Oh, you know what? I think we're doing a little bit of overreacting. So again, this isn't to try to deny that Trump didn't say stupid crap, but it's also the reality of like, okay, well, let's look at it realistically, not like ideally. If Biden's in office, maybe he talks about it better, but what does he do that's better is what, that's where
I think it's a bit, I think it's a bit dubious to ask what would he do. He's not president, so per definition, he can't do very much. The thing I would say is this, even if I admit that people within the Democratic Party, and it's an admission I can readily make, were late in spotting the virus, I think what was far worse in the case of Trump is how little he's learned and how obvious it is that he's learned nothing. And I'll give you examples. As late as May, he was talking about freeing all of these states which were opening in contradiction to health guidelines that that his task force had put out. He was talking about opening schools. I live in Israel. Opening schools is considered to be one of the determining factors which led to Israel being in such a crappy state. Originally, Israel was in a great situation with COVID. We were one of the safest and most effective countries in the world. And I don't think that opening schools was independently responsible. But I think that when you take Trump's statements throughout May, throughout all the way through July, and even now he wants to open up the NCAA, the entire thing is quite absurd to me. And it shows, I think if you want to make the argument that the Democrats weren't on top of this in the beginning, it's an acceptable argument, although they certainly didn't go as far as Trump did in denying it and calling it a hoax and other things. But the fact that he's still pushing for things to be open, the fact that he pushed for university campuses to be open, and university campuses promptly became a hotspot of the virus, proves that over half a year into this thing, he's learned nothing about the severity of the virus. He pushed all of these states to open, and we literally saw states. I have the graphs in front of me in Florida, in Texas. Let me pull up all over the country, Arkansas, all over the country, cases rising because Trump encouraged largely governors to reopen. There's a reason why Republicans right now don't believe in wearing masks, which is clearly scientifically indicated to protect the virus. Why Republicans are skeptical about it at far higher rates than Democrats are. And it's because they've been consistently fed not over weeks, but over months. They've been consistently fed mixed messages, denialism, false promises. You talked about Trump being optimistic. Trump was on the Titanic, optimistic about icebergs. That's how I see his optimism. It's not optimistic to tell somebody who are a cancer patient, you don't have cancer, we don't need to do anything about it. That's not optimism. That's called being delusional. And I'm not denying the fact that Democrats could have been more on top of it. But we're in August, mate. We're not 5 months ago, and he still hasn't learned.